Hi viewers, I welcome Dr. Varun Suryadevara to our YouTube channel. So Dr. Varun is a prominent endocrinologist at Bangalore. First we'll learn a few things about Dr. Varun. Dr. Varun, will you tell us something about where you have done your studies from, where do you belong to, and what are you doing in Bangalore in the field of endocrinology?
So I hail from Andhra Pradesh. I did my MBBS from Rangaraya Medical College, Kakinada. My MD Internal Medicine from PGMR, Chandigarh, and my DM Endocrinology from JIPMAR, Pondicherry. So currently I am working as associate consultant in Department of Endocrinology, Apollo Hospitals, Bengaluru.
And we also have the pleasure of having Dr. Varun work with us at Magna. So we are both from the same place, JIPMAR. JIPMAR, I did my MD internal medicine. So it's a great pleasure to have Dr. Varun work with us. So today we'll discuss a very interesting topic. Endocrine system can sometimes affect muscle function. So sometimes if you're having difficulty walking or getting up from a sitting position, so this all could be due to endocrine problems. So I'll ask Dr. Varun a few questions so that you can understand a little bit about endocrinology and muscle function and muscle power, muscle weakness, etc. So, Dr. Varun, one thing I want to know from you, how common are this endocrine problem of endocrine related muscle dysfunction? How common is it, and do you see it often in your clinical practice, and how do you go about suspecting it? All these things. So you can just tell the audience some things about these aspects.
So there are various endocrine causes of myopathies. The muscle dysfunction or hypofunction of muscle can happen either primarily because of muscle problem, primary myopathy, or because of an endocrine disease causing nerve dysfunction. So even the more commonly diabetes can cause some of the diabetic neuropathies can present as myopathies, or the excess and deficiency of thyroid hormone, or an excess of cortisol hormone or growth hormone can also present as myopathies.
Thank you. So one more thing I wanted to ask you. So you were mentioning about steroid induced myopathy. So I want to point out one or two things and ask you some questions about it actually. So in my clinical practice, what I find is that the most common endocrine myopathy is actually a steroid induced myopathy, because so many patients take exogenous glucocorticoids for various autoimmune conditions. They take for conditions like rheumatoid arthritis, SLE, autoimmune hemolytic anemia. There are so many conditions for which patients take steroid therapy. And how do you know that whether your muscle have been affected? If you are on steroid therapy, how do you know that your muscle have been affected to the patients? No, and what can one do about it to reduce the impact on your day-to-day life?
So how the patients usually complain is the steroid myopathy usually affects the proximal muscles more. So patients usually complain of difficulty in getting up or lifting their hands while difficulty while combing their hair. These will be the usual symptoms. So although the steroids are essential medicines in treating these rheumatological conditions, they do come with certain adverse effects, and the myopathy is one of those adverse effects. So we have to limit the duration of the steroids to the minimal extent possible and the minimal doses as possible. At the same time, the optimization of calcium, vitamin D, the other factors, and the associated hormone status is very important to prevent the myopathy.
One more question. I think all our audience, have learnt a lot about vitamin D deficiency. So, have you seen in your practice any, severe muscle dysfunction secondary to vitamin D deficiency? So, can you describe any patient that you've seen in your, you were trained in JIPMER, you must have seen definitely some patients. So, can you just share any anecdote or story about these things?
So although it can happen, it's not very common. So in pediatric age group, like it can happen with severe vitamin D deficiency. Patients can present with bone deformities or with myopathy. However, in adults, it's not so common. Like except for like 1 or 2 patients, like it's not so common.
Yeah, no, I'll share an anecdote. So, recently I came across a patient who was like in this pediatric age group only. The only complaint actually for the patient was that she could not walk properly. She could not get up from the squatting position easily. She also had deformities. She had rickets. She's a pubertal girl. She was in 10th to 11th standard. So, and this period is a period of rapid growth where the demand for vitamin D is also very high. So, and again, in this period, you do get vitamin D deficiency. So, what happened was, the patient only complaint was that could not stand, could not walk. Okay. So, there are some rare conditions called hypophosphatemic osteomalacia, hypophosphatemic rickets, like that. So, I thought the patient might have any one of these things, but finally, the patient turned out to have only severe vitamin D deficiency. So, patients typically have something called a waddling gait, like a duck walks, no. So because the weakness, they are not able to walk also properly. So it can be quite severe, though vitamin D deficiency is extremely common in certain age groups where the demand is more and the supply is less. Supply is less for all of us. All of us are vitamin D deficient. There is an epidemic of vitamin D deficiency. The vulnerable population will be pubertal children and children who are in the first 2 years of life. They are the ones who grow the maximum actually in those 2 years. They are the ones who get rickets, both in the pubertal age group and in the newborn first 1 or 2 years. They get this condition. So this is something that you need to watch out for. These are some of the ways in which our muscles are affected, and muscle weakness can be there due to endocrine causes. So we'll hope to bring you more and more interactive sessions and some videos by Dr. Varun also. Dr. Varun also will launch his YouTube channel in a short while. So you should all subscribe to it and watch his content as well. Thanks.